Depression. What you should know. Depression is a very common mental disorder. According to World Health Organization, more than 264 million people of all ages suffer from depression globally. It is a deadly disease as it may lead to suicide. There are effective psychological and pharmacological treatments for depression, but it is important to get professional help in time. If you feel incapable of pleasure or lack of interest in any pleasurable activities, if you feel irritability for prolonged periods most of the day, if you feel everything in the world around is dull and lifeless, or complete negative outlook towards life, if you feel nothing is going to be alright anymore, or feel lack of self-esteem, if all your thoughts lead you to the same dark, miserable road ahead, if you think you had enough of this life and want to put an end to it, if any of the above symptoms last for at least 2 weeks, please don't hesitate to seek professional help. Know that all these negative thoughts and feelings are symptoms of this disease. Depression is a disease like cancer or any other serious ailments. There may not be much physical symptoms as the distress is happening inside. You can't get over it on your own. Just think that you lost your way in a jungle. A psychiatrist or a clinical psychologist can guide you to brighter roads. Just give it a try because life is precious. If someone you know tells you he or she is going through any of the above feelings or is showing any of the following symptoms, please persuade him or her to take professional help as soon as possible. Check out for the following symptoms: lack of interest in any pleasurable activities, mood swings and anger outbursts, prolonged periods of irritability, a very pessimistic view of life, talks of ending one's life, lack of appetite or overeating, suddenly losing or gaining weight. You can be a good friend with an intention to help, but know that depression needs professional intervention. Mere chats and hugs don't cure depression. Professional help is needed for depression because of the following reasons. Depression results from a complex interaction of social, psychological, and biological factors. People who have gone through adverse life events like unemployment, bereavement, psychological trauma are more likely to develop depression. There are many kinds of depression. According to the number and intensity of the symptoms, depression can be categorized into mild, moderate, and major depression. There is a chronic variety called dysthymia. Depression can be associated with psychotic disorders like bipolar. There are substance abuse induced depression. Moderate and major depression and other psychotic depressions need medications to settle and then only can be accompanied with cognitive behavioral therapy and other psychotherapies. It is important to get diagnosed and treated appropriately. Only a professional can diagnose the exact nature and intervene appropriately. Hence, it is important to get professional help. But of course, a friend or a well-wisher can provide social support by being there to talk and being helpful. Check out and reach out. You could be saving a life. Thank you.